Welcome back to Emotional Mojo. You know, the number of Americans diagnosed with diabetes is growing at a rapid pace. Nobody is immune. It can affect anyone. Take a look at this.
I was mentioning as you came across, you look wonderful. You look like a kid, for God's sake.
Thank you. I've been maintaining the temple, Dave. I've been maintaining the temple.
Doing a good job.
I went to the doctor, and he said, "You know those high blood sugar numbers you've been dealing with since you were 36? Well, you've graduated. You've got type 2 diabetes, young man. So, well, it's controllable."
So, yeah, we saw that in the news recently, people talking about Tom Hanks, along with 25.8 million other Americans, by the way, who suffer from diabetes. And joining us to talk about it is best-selling author and medical doctor, Dr. Don Colbert. Welcome to our show.
Well, thank you. It's great being here.
We're happy to have you. You know, that's a staggering number of Americans suffering diabetes, and I think it's good when you see a celebrity come out. You know, you mentioned Paula Deen as well, because it keeps the conversation going. I mean, how serious is this?
Well, it's very serious because not only are there 25.8 million with diabetes, there's 79 million with pre-diabetes, which will usually go on to develop type 2 diabetes.
What is pre-diabetes? Like,
well,
how do you know?
Well, pre-diabetes, you don't know.
Okay.
That's the thing. With diabetes, typically you have symptoms of frequent urination, as well as thirst and sores that don't heal and visual changes. And with guys, ED at a younger age.
Really?
But with pre-diabetes, no symptoms. Kind of like a house with termites, where you don't see the termites. The house looks great, but then after years, all of a sudden, boom, the door starts to fall off, or a picture falls.
So what is the number one thing that someone can do to prevent, to go from pre-diabetes to diabetes? Number one thing that you can do to prevent that?
Well, the big thing I tell people is it's the waistline and the diet and exercise, a combination of things. I can't give you just one.
All the time.
Okay. But to answer your question, how do you know? How do you know? Typically, I can know by looking at someone.
Oh, that's scary.
If a person, now if a woman has a waist 35 inches or greater, they usually have pre-diabetes. If a man has a waist 40 inches or greater, they usually have pre-diabetes or insulin resistance. So you can look, you can look at it.
Well, and it's interesting because Tom Hanks in that clip said they were jokingly telling him, you know that high blood sugar you've been dealing with for years and years? So, I mean, he had signs too. If somebody had just come in and told him.
Right, but it doesn't always pick it up on the blood test. See, when you go to your doctor, he'll draw your blood and he'll run a chemistry panel, and you go in fasting 12 hours and it may not show up, but it will show up on a hemoglobin A1C. That tells what your sugar's been over the last 3 months. So if you go in there, and most doctors don't do it unless you're diabetic, but if you go in there and ask for a hemoglobin A1C, all of a sudden if it's 5.7 to 6.49, bingo, you have pre-diabetes.
That's how we catch the cheaters.
That's right. Absolutely right.
We talked about preventing it, but let's say you have diabetes. I'm looking at your book, and it says reversing diabetes. So is that possible, and how do we do it?
Now again, it's always best if we can catch it in the pre-diabetic stage, because it's very simple. Yes, you can, to answer your question, if we catch it soon enough. But if a person's had diabetes for 10 years or greater, typically it's very difficult because you've usually destroyed at least half of the beta cells in the pancreas that produce the insulin. But the key, again, is starting on the waistline. As that waistline comes down, the sugars come down. See, the sugars follow the waistline, but also the diet, critically important, because people say, oh, I cut out sugar, but my sugar's still elevated. But if you, let me explain, the numbers show that if you eat 2 slices of bread, now what's interesting, it can be white bread or it can be wheat bread. It can raise your sugar in a non-diabetic 40 to 80 points. Now, again, in a diabetic, it'll raise it 80 to 120 points. And the reason being the amylopectin A that's in the bread, which is a starch that converts to sugar like that. So again, the bread, the wheat, and the corn can really spike the sugars. So we have to eliminate or diminish certain foods or add your soluble fibers to these foods, like I know the dietitians teach
you know. So you've mentioned the waistline several times. So you would say that one of the biggest things that you can do is reduce that waistline. So it's, I mean, and I've been saying that forever too, that it's, you know, if there's one thing you can do in your life, it's don't smoke. But the other one is to maintain that healthy weight. What else can people do to reverse diabetes or prevent it?
What's the deal with coffee?
Yeah, I was going to say that because we love coffee.
Huge study, 450,000 patients back in 2009 found if you just drink 1 cup of coffee a day, it decreases your risk of developing diabetes by 13%.
How? Yes.
I'll tell you in just a second. But then if you have 4 cups a day, guys, it reduces your risk of diabetes by 47%. Now how?
Okay.
First is chlorogenic acid in the coffee, which is a powerful phytonutrient that lowers blood sugar. Now it's also found in the green coffee bean. They find if the coffee is roasted that it destroys much of the chlorogenic acid. But if it's light roast instead of dark roast, very little of the chlorogenic acid is destroyed, so choose the light roast.
And don't dump a ton of creamer and sugar.
No, that's the key now. Yeah, if you're dumping cream and sugar in there, you are offsetting it. Absolutely. But now they have skinny coffees, you know, skinny mochas and things like that, which is okay. And again, so many people think, oh no, I've got pre-diabetes, my life is over. I have diabetes, my life is over. That's false.
Okay.
And again, it's just learning how the right kind of foods to eat and the things to combine with it. Like we have some amazing natural things that help lower the sugar, like cinnamon. Or soluble fiber, or the green coffee bean.
And I love that you talk about that too, because I think we need to mix this Western and Eastern ideas of medicine, because you know it can't hurt. So thank you for sharing the information. You guys, his book is available now, Reversing Diabetes. Make sure you pick that one up.